Hello, everyone. Thank you for attending today. I am so excited to introduce our speaker. We are so fortunate to have Dennis Uma, who is our visiting fellow for 4 weeks here in Arizona with us. And he is a professional fellow with a professional fellowship program on inclusive engagement through the Institute for Community Inclusion at the University of Boston, University of Massachusetts, Boston, and Humanity and Inclusion, with funding support from the U.S. Department of State. And, we've been fortunate to host other fellows in the past, and I'm so excited that Dennis here was willing and wanting to actually do a session that's broader to our audience here at the university, our larger community, and for those of you I know, I think across the AUCD network and others who are joining with us today online. But this program really allows both for knowledge and cultural exchange. And today we get to benefit from that cultural exchange and hear more about the disability context within Uganda. And so with that, I'm going to turn it over to Dennis, and I'll let you further introduce yourself, because I know you have many hats that you wear. And so we're so excited to have you with us today.
Thank you. Thank you, JC, for that very kind introduction. Well, I don't know if there is anything else left for me to introduce myself about, but yes, it's an honor to be here. Good morning, good afternoon, and good evening, everybody on call, depending on where you are tuning in from. My name, as introduced, is Dennis Ouma, a professional fellows program participant on disability inclusive civic engagement.
Mind if we just pause? I think you need my this is what I said. I'm sorry that give me a second.
Is this better? All right. Okay, I've already been introduced. Dennis Ouma. I'm visiting from Kampala, Uganda. That's in East Africa. And like I always add, probably the most beautiful place on planet Earth, which is why we are the Pearl of Africa. My job is very easy today, and I'll keep it as simple as possible to try and share disability as a concept from the Ugandan perspective. And pretty much that should give us an idea of what the African perspective of disability is. Okay, so I want to pretty much share the challenges and opportunities for individuals with disability in Uganda, which is going to be an analysis of the healthcare system, the education system, work, and political participation, the bias on individuals with disability. To bring us to speed with the general overview of disability in Uganda. A child with disabilities, in most cases, can easily be seen as a curse in Uganda, which in turn brings shame to the family, which means it is not uncommon for mothers to be told either to abandon their children or even worse, kill their infant child because of the disabilities, which consequences can really be dire. And it is commonly rooted in superstition And these views can result in situations where children with disabilities, such as cerebral palsy, are left lying on the floor. They live very lonely lives, very miserable lives, isolated, and oftentimes suffer from malnutrition, respiratory problems, or pressure sores. The resultant effect, ladies and gentlemen, is that many of these children die. Next slide, please. Now, the general perspective as a result is that children, or even persons with disabilities in general, are denied health care. They do not attend school. They are at a higher risk of abuse and sexual violence, as well as being hidden away, warehoused, out of sight, or even worse. I shared some photographs here of some children with disabilities in a nursing home. Many of these children have either been abandoned by their parents at the nursing home or at the police stations. Some have been picked from the streets and fortunately have been given shelter in a nursing facility. Myself and colleagues back home have partnered with this specific nursing home, and we are happy to share some parasport activities, specifically baseball, over the Saturdays and Sundays with these children, to give a chance to these children with different disabilities to play, to interact, to smile, and to feel a part of the community. We're also happy to mention that we are paying school fees for up to 8 of these children in primary school, giving them a scholarship with my colleagues for 8 of these children as an ongoing effort to try and get them an education. In this photo on the screen, as part of the work we do in Kampala, having founded the Spinal Cord Injuries Support Society, part of our programs is to do hospital visits to the spinal cord ward of the National Referral Hospital, which is Mulago Hospital in Kampala. And I'm sharing this, as part of my community effort. That's where I started up in this particular place. That is on the 8th of July, 2008, when I was involved in a motor accident. I was 23 years of age, and that is where I sustained a spinal cord injury. And thus forward, I became a person with disability. One of the statistic of 12.5% of Uganda's population being persons with disabilities. That is approximately 6.5 million people out of 40 million being people with different disabilities. Now, to briefly discuss about the accessibility to healthcare services for individuals with disabilities, I like to keep my conversations pretty much personal, where my life is my story. My personal story pretty much describes my life. So 19% of the Ugandan population over 5 years of age live at least one disability. That is a huge statistic. The prevalence of disability in Uganda increases with age from 12% for children between 5 to 9 years of age to 67% for those over the age of 60 years. I'm happy to share some of the barriers to access and utilization of healthcare services for individuals with disabilities. Knowing that only 13% of persons with disabilities, functional disabilities, report using an assistive device. Only 13% persons with disabilities report having access to an assistive device. Now, persons with disabilities are often not considered a priority area for funding purposes. And the reason for this is because a significant proportion of the Ministry of Health funding derives from international donors who may not prioritize disability issues. And that is often have a disease-specific agenda, such as HIV, AIDS, neglected tropical diseases, and malaria. Therefore, disability is not usually prioritized. Next slide, please. From a personal experience, on the night of the 8th of July, when I had an accident, a spinal cord injury. Of course, at the point in time, I'd never heard of the word spinal cord injury or ever interacted with anybody with a spinal cord injury. I later learned that there is an incidence of spinal cord injury of more than 2,000 people getting injured every year in Uganda, which is a huge number. It took me 4 days to interact with the medical personnel, despite, of course, the need for emergency care service for anybody with a spinal cord injury or any other injury there. This lack of emergency care is part of what is responsible for compounded resultant effects from spinal cord injury, among others. Now, generally, that speaks into the inadequate specialized healthcare services and personnel, for that matter. There is an inaccessible physical environment in many healthcare centers. Part of what compounds the inaccessibility is the lack of sign language interpreters in healthcare centers. It's expensive to access quality healthcare. There is stigma, healthcare professionals, and this is especially true for women with different disabilities who are seeking maternal health care services. There are many reports of negative experiences between these women, disabilities, interfacing with the healthcare professionals. In one research, we found stories from different mothers with physical disabilities who confessed to the fact that doctors were asking them why they were unable to climb the delivery beds during delivery, and yet they found it very easy to climb the bed during intercourse. These, among many more other stigma stories, have kept away women with disabilities from healthcare centers. And they prefer, as a result, to use traditional birth attendants who are inexperienced, and in most cases, the results are fatal for women during labor. Just to make before I complete the healthcare system, I'll go to the educational systems for students with disabilities in Uganda, and also pretty much love to share my personal experience that is a good reflection of the general situation of the education system in Uganda. Now, to share some statistics of the situation, 90% of children with disabilities in developing countries in general do not attend school. 13% of children in Uganda are living with some form of disability. That's about 2.5 million children according to UNICEF report in 2014. Only 15% of children with disabilities in Uganda access education, according to the state of access to education by women and girls with disabilities in 2004. Now, we have 113 special schools across the country in Uganda. By special schools, special needs schools, we mean schools that are specific to disabilities, such as school for the hard of hearing, schools for the deaf, schools for the physically handicapped, which is a good starting point in a way, but continues to promote institutionalization of individuals with disability where students are unable to interact freely with their non-disabled folks. The problem with this system is that there is a limitation how much exposure these students with disabilities can get access to. You can imagine a human resource personnel who has never interacted with a person with disability, which is not uncommon, interfacing with one at the interview panel for the first time. The biases as a result on the limitations of the individual with disability may inhibit free competition for job placements. Next slide, please. Now, government has committed, according to the Education Act of 2008, to ensuring that all children of school-going age and all individuals who are interested in acquiring an education have equal opportunity, regardless of their social class, ethnicity, background, or disabilities. However, implementing a full inclusive education system requires systemic changes to curriculum, pedagogy, and funding models. So widening ranging reforms are needed, enable the flexibility that an inclusive education approach requires. Next slide, please. Further share a little bit about my personal experience in education. I had this accident in 2008 when I was a third-year student in Makerere University, after which, given the multiple limitations of my physical body, being quadriplegic and unable to use my hands or feet, I could not write. And therefore, my pursuit for an education at higher institutions of learning met a dead end for close to 10 years, where many universities could not allow me back into school for the purpose that I was too disabled, unable to write my own tests or exams, unable to ascend into the lecture rooms or the libraries. And yes, I myself also did not know how best to be reasonably accommodated back into class. All I knew for sure was that the law, the legal regime in Uganda, said that government and institutional education institutions needed to do everything possible to ensure that all individuals, irrespective of their disability, be in class. But there was no universal design in the Universities and Higher Institutions of Learning Act that were recommended for these universities to ensure an inclusive education. So I knocked on the doors of several universities until when Makerere let me back in, complete my fourth year. I hired writing assistants, recording equipment, full-time invigilation for me to be able to sit my tests and exams. I cannot begin to mention how inaccessible the physical environment is. how many lectures I missed as a result, among others. Now, more to that, that speaks into the non-accommodative environment across academic and non-academic spheres. Majority of academic staff have no knowledge of the disability-related needs of students with disabilities and rarely provides for them, nor takes them into consideration in lectures, assessments, and examinations. Many libraries have not yet provided or adapted disability devices and ICT to enable certain students with disabilities to access library resources. This is documented literature according to Emong and Aaron in 2016. Essentially, many of these barriers to inclusive education, according to the World Bank, points out that public financing for special needs education accounts for only 0.1% of the education sector budget. This is also documented according to the technical guidance note edited final version of 2021. Happy to mention that I did succeed at my first bachelor's degree in commerce and graduated. I went on to do a master's in disability studies at Chambogo University, which I'm still pursuing, as well as another master's in corruption and governance at Sussex University, the UK. Despite the challenges there, which is why my personal story is the premise upon which I have based my outbound project aimed at training and mentoring students in higher institutions of learning in Kampala, in Uganda, to be trained and mentored into self-advocacy skills, pair them with mentors who possess the necessary skills and expertise to train these students with disabilities into educational success practices, career guidance, personal growth and development, as well as appropriate transition into the employment sector after universities. This, in essence, seeks to enable the student with disability know their rights and be able to demand for the appropriate inclusive practices while at university. Now, to further speak about employment opportunities, the workplace environment, there is a lack of unemployment benefits in Uganda in general, which has meant that all able-bodied individuals must access employment in order to escape poverty. I think this is pretty much a different experience for our folks here in the United States. Now, according to the Uganda Chronic Poverty Report, 26% of the total population lives in poverty, abject poverty. 2006 United Nations Health Survey found that almost 80% of persons with disabilities live below the poverty line. The same report found that 46% of persons with disabilities declared that they were excluded from accessing employment on grounds of disability. That is according to Nyombi and Chibalama of 2014 report. Part of what this means is that employers are not fully aware of the reasonable accommodation needs of individuals with disability. You could easily find an interview room that has been prepared on the 3rd floor or 2nd floor, and a wheelchair user like myself will show up and is unable to ascend to the interview venue, sit an interview. How then can we hope to be reasonably accommodated after the job has been offered, if we even can't get through the interview? I'll mention without fear of contradiction about the weak legal regime. The weak legal regime as a barrier to employment of individuals with disability. And why do I say weak legal regime? The law in itself speaks about quota systems. There are several employment provisions within the Persons with Disability Act of 2020, such as 5% positions for every employer to be reserved for individuals with disability. This is yet to be implemented. It's an affirmative action requirement for all employers to employ persons with disability, which is also yet to be included. There is limited awareness of the potentials and rights of individuals with disabilities. Accessible environments, which I'll partly attribute to the inadequate curriculum as well as a barrier to employment. As we come to the end of my presentation, I'll quickly run through political participation and representation of individuals with disabilities in Uganda, which is a very passionate subject matter for me. Having contested in the 2021 general election, where I sought to represent individuals with disabilities in the Legislative Assembly. Now, elections provide a unique opportunity to increase participation and change public perceptions about the abilities of persons with disabilities. That's for sure. As a result, persons with disabilities can have a stronger political voice and be increasingly recognized as equal citizens, which sets the stage for ongoing participation in their communities, the social and economic integration. Despite this need, however, the attitudes to the value of inclusion of people with disabilities in decision-making process remains to be negative. There's lack of accessible information on public meetings and consultations, political parties, voting and registration. There's lack of transportation to public meetings, registration centers, and polling stations. So many individuals with disabilities who have mobility challenges are oftentimes left out of the political processes. There's also physical barriers to public buildings, including courts of law, voting, registration centers, and polling stations. I've always told the story of how we had a petition in the court on accessibility to public buildings, and the court hearing was slated on the 3rd floor, where we, the petitioners, could not access the proceedings. Some polling stations are in rooms too small to accommodate people using wheelchairs. Voting boxes are placed in high tables. This is common. There's lack of accessible information on voting procedures for voters with sensory disabilities, who are oftentimes therefore neglected. This speaks largely into the poorly trained election workers. There's hostility and exclusion of people with psychosocial disability and intellectual disabilities, decision-making processes, whom the law has shut out totally and are not eligible to participate in the voting process. There's lack of alternative voting devices or accessible voting methods for people with sensory disabilities. Lack of mobile voting mechanisms for people who cannot leave their homes, who are currently residing in hospitals or institutions. And institutionalization of individuals with disabilities is a common phenomenon. So large numbers of my colleagues do not participate in the political processes. Next slide, please. On the screen are photos of myself. The first photo above was the day of our nominations for the general election in my pursuit for to represent my colleagues, the National Assembly. Second photo below is one where on nomination day, where we're nominating presidential participants, I had escorted my political party candidate and could not be let through the police barricade for many reasons. And despite my disability and the lack of knowledge of how to handle my disability by the security forces, it was quite a bad experience. As you can see, the policeman was wheeling me in this wheelchair with my brakes on, you know, and that speaks into the general lack of knowledge and understanding of the needs of individuals with disabilities by the implementers of electoral processes. That is a large gap that hinders political participation for individuals with disability. I'm happy to share that story later upon request. It was a very, very interesting engagement for sure. Now, interestingly, there are more than 70,000 representatives of persons with disabilities across the country, political representatives from the village level, the parish level, sub-county level, the district level, across municipalities, where there is at least male and female councillors representing individuals with disabilities. There is always a committee at all these stages, committee of about 9 people representing individuals with disabilities at the local councils who are mandated to deliberate on issues relevant to individuals with disability. Their capacity, however, meaningfully engage their colleagues in the councils is very limited. And this has continued to hinder fruitful deliberations and outcomes for individuals with disabilities, among other challenges. Next slide, please. Now, the government of Uganda has made a series of commitments to the rights of people with disabilities, which include affirmative actions in legislation and policy, quota system for political representation of people with disability at all levels of governance, the Persons with Disability Act of 2020, which provides for the respect and promotion of human rights for persons with disabilities. However, despite the good intentions of government outlined in legislation and in policies, huge gaps remain how they are implemented, monitored, and degrees of compliance. The question that requires a lot of concerted effort from all stakeholders across the civil society, government agencies, ministries and departments, disabled people's organizations, the media, faith-based organizations, the church, among others. It is a privilege to be here in Tucson, Arizona, United States, to learn from best practices. The healthcare system, the education system, employment, civic engagement practices. It is my hope, my sincere hope, that we can leverage this fellowship experience on best practices, go back home and begin some small steps, giant leaps that can then lead to meaningful inclusion for persons with disabilities in Uganda. Thank you very much for listening to me. I'm happy to take any remarks or questions. Thank you.
Hey, if we have any questions in the Zoom room, you're welcome to come off mute or put them in the chat.
Any questions here in the room? And I'll pass the mic. Oh, we do have one question in the room.
Hi, thank you so much for sharing your struggles. I don't have a question, but it's more like a comment. I'm from India, and I felt like there were so many similarities in our journey because, I mean, you said that in Uganda it's seen as a curse, but in India it's kind of a curse. We associate it with the theory of karma, like you might have done something wrong in your past life to get this, and then society is not responsible for helping you because it's something that you brought upon yourself, and which is like, yeah, it's a way of like, okay, and people stop expecting things from you, and you almost become a nobody after you're diagnosed, or if you're disabled. And yeah, I mean, I was like listening to you and thinking about my struggles. I was also diagnosed with multiple sclerosis when I was 28, 29 in India, and I didn't have any insurance because I was working in private sector, like I was working a temporary job, and then I couldn't afford my medicines, and then uh and my employer fired me, said because multiple sclerosis is sort of unknown in India. It's very Caucasian disease, and it's now being like people in India are now being diagnosed, but nobody knew about it. And so there were like so many misconceptions about what I was going through, and especially because it was invisible. So I had to prove myself all the time why I was not coming to work, why I was not feeling well. And yeah, and that was when I decided to come to US and pursue my PhD. But it was, I mean, it's nice that you're thinking of learning from here and like sort of implementing those things back home. That is a great thing. And yeah, I mean, it was an inspirational story. And yeah, thank you for sharing. And yeah, I look forward to chatting with you maybe sometime about like challenges in India and challenges in Uganda. And
The way forward.
thank you.
Dennis, did you have a response or we have another question here?
A quick response.
Yes, of course.
Thank you. Thank you for those very kind remarks. I totally relate with, the idea of disability being a result of something you did in the past. That too is common where we come from. And that compounds further the idea of ableism, where individuals with disabilities are inherently thought as inferior beings, which makes worse the idea of the stereotypes and the discrimination, and it creates gaps inevitably where must then speak up as a people using disability as an identity. We must really speak up to defy all these odds and be able to project ourselves as able to compete, with anybody else for available opportunities. And many times governments listen to the loudest voices. Loudest noisemakers get government attention. So it is a call to all our individuals with disabilities, to be intentional, seeking out all these gaps and speaking out endlessly, with consistency, with resilience, so that at the end of the day we can achieve the change we so desperately seek. Thank you. Thank you for your time.
Okay, and we have another question here in the audience.
So, thank you very much for your presentation. I really appreciated it. I And you did mention this briefly in your remarks to the last comment. I wondered if you could talk about the potential and the history for disability activism in Uganda. I know at least here in the US, a large part of all the strides that we made in the last 20, 30 years have been from disabled people's activism, but then also activism from allies like parents, family. Uh, From my work in Cameroon, I know that that is not always the easiest thing to do in every country with different political systems, but I'm just wondering if you could speak to the potential or potentially the history of disability activism such as disability rights movement, disability justice and related.
Thank you. Thank you, Dr. Austin. The disability movement in Uganda traces its history primarily from the Constitution, the Republic of Uganda of 1995 as amended, which provides specific articles on disability inclusion in education, in healthcare, in employment, accessibility, among others. However, it did not gain much prominence until 2006, after Uganda ratified the United Nations Convention on the Rights of Persons with Disabilities. That is when, after ratification, then we have since, as a government, sought to domesticate many of the provisions of this internationally binding legal instrument, the UN CRPD. We know that from 1996, we have then had representatives of people with disability, the national parliament, to try and, raise our voices at that level in parliament, representatives at the district level since 1996 as well. But the major effort in as far as the disability movement is concerned has been concentrated, especially from the organizations, people with disabilities, which are multiple, with the national umbrella being the National Union Disabled Persons of Uganda and people leading the effort, the advocacy effort across the country, as the national umbrella responsible for monitoring other organizations of people with disability. Many of these organizations are disability specific. We have organizations of people with physical disabilities, organizations of persons with albinism, organizations of the deaf, hard of hearing, among others. So many efforts of advocacy and activism are usually initiated by these organizations of individuals with different disabilities at that level. So there is an ongoing effort for sure. I know of a fact that a lot needs to be done, to ensure basic issues provided for in the law, issues like accessible buildings. The law provides for these things, but I guess there is a lot we need to do in advocacy and activism to bring these issues to the light, so that all concerned individuals, concerned parties are able to heed our call and act. So there's an ongoing movement really. But learning from the efforts that have been executed here in the United States, from the ADA to civil rights movement that has informed therefore other activism initiatives. It's brilliant. We are learning a lot from these initiatives, and hopefully we can go home and, teach our colleagues a thing or two that can then inspire our own movement, realize these rights.
think we do have a question in the Zoom room. Someone's raising their hand. You're welcome to come off mute and speak.
Okay. Hello. Okay. This is Moses,
Yes, Moses.
right? Thank you so much, Dennis, for the wonderful presentation. Moses read Professional Fellows Program. Currently based in Washington, D.C. This is where I'm joining my call from. It has been nice hearing from you, and of course, sharing about the perspective of Uganda. Dennis, I have one thing that I wanted to ask about how you are trying or planning to approach it. In education, there is still a challenge, like at university, students who are hard of hearing cannot easily benefit from the government sponsorship. Sometimes they need hard of hearing persons to only be able to sign such that they can be able to benefit from the government sponsorship. This is something that is not accommodative. Hard of hearing persons have different adaptations, and that is how they can live in society without bringing about misconceptions. I don't know how are you going to help us be able to address this issue with the public universities. It is something that the Hard of Hearing fraternity has been craving for so long. I hope that this opportunity will help us address this issue. And then the last issue is about the election process. I'm happy that you have talked about the political participation, and my research or my project here in the United States is about increasing political participation for young people with disabilities. And I think there is a lot of stigma among young people with disabilities when it comes to political participations. And this one has disempowered many to participate. Why? They have knowledge and capacity gaps. Civic education is not sometimes made available to many in maybe different formats, things like that. And I reason that it is imperative for us to join efforts and rally stakeholders to understand the civic participation challenges for young persons with disabilities to be able to actively contribute and also participate in political processes, because underlying there are political benefits, social benefits, and also economic benefits of participating in an election, including being able to participate in demanding for accountability and effective governance. So thank you so much, David, for your presentation.
Okay, thank you. Thank you. Thank you so much, Moses. Sebada from Washington. Well, to begin with your second remark, it's pretty much not a question, but I'm open for collaboration, you know, collaboration with you, whose project is seeking towards achieving political inclusive processes for individuals with disabilities, for youths with disabilities. I think that's very phenomenal. Your project is interesting, and we need to build synergies with organizations like the Coalition for the Rights of Persons with Disabilities Activism Uganda. Well, I'm open to collaborating with you on that front, because it is until when young people with disabilities have a say or sit at the decision-making table, the political systems that then can meaningfully, contribute to the policy frameworks and get inclusive outcomes for individuals with disabilities in general. But to answer your question on how I hope to achieve inclusion for hard of hearing students in higher institutions of learning, I think this is a very direct part of my follow-on project from this fellowship program, where as part of our activities, hopefully my host mentor shall join us in Kampala, Uganda on this one. Part of our activities seeks to engage the National Council for Higher Education, which is the government agency responsible for monitoring and evaluating higher institutions of learning. We hope that by interacting with the National Council for Higher Education, we can then identify where the loops are in as far as the universal design is concerned. Because what you cannot measure, you cannot plan for. So hopefully by interacting with this government agency, we can identify the specific gaps within the law that governs higher institutions of learning, and then the needs of the hard of hearing can be identified. That is on one hand. Secondly, our project, my follow-on project, seeks to build the capacity of individuals with disabilities, amongst whom the hard of hearing will be a great part. So we build their capacity to clearly identify what their rights are, be able to articulate what their needs are, so that at that level they can self-advocate with the university administration to be able to tackle what their specific needs are. Thirdly, part of our activities in my follow-on project seeks to get the indulgence of the university administration to guide them either to review or initiate and then eventually adopt best practices and policies as far as disability inclusion for their students in the higher institutions of learning is concerned. So our pilot project is in Chamboko University, and hopefully we can have this replicated across universities in Uganda, so that an inclusive and meaningful education for the students in higher institutions of learning can be a guarantee moving forward. Thank you so much, Moses. I hope that answers your question.
Yes, thank you.
And I know we're just about at time right now, maybe 1 or 2 minutes over. So I want to say, Dennis, thank you so much for your expertise and insight in this presentation today. It was amazing. And thank you everyone for attending. If we didn't get a chance to answer your question today, we will be saving the chat. Our TA can go ahead and put our university email address in the chat, and you can feel free to email any questions there as well, and we'll pass them along to Dennis. And Dennis, you couldn't see because you were presenting, but there are many, many compliments in the chat. So we'll be sure to pass those along to you as well. So thank you so much, everyone, and have a wonderful rest of your day.